catheter rupture, obstruction by clots. Yeah, it has that three-way valve. That's the difference between that and the Hickman.
Plus they're usually single lumens. Those are usually single lumens.
Yep, and like Tim was saying, the air embolism, it's less risk for this. It reduces that, those risks it have. Oh, well, how about this one, you guys? What have you seen with this one?
How does it draw blood from? Is it that valve?
That's the one.
Yeah. Open.
Yeah, because those valves are this way and then you have to reverse them to come through. And they're
that
pain in the
pressure.
butt sometimes. Sometimes you can't even get them to do it. So.
Okay. Anybody else with this one? This one we kind of see more often, the PICC line. They're biocompatible materials. They come in lots of different sizes. Large PICCs can have multiple luma. The indications for getting a PICC line, what are some of those? What do you think? There's a bunch of them. What do you
Certainly with real friable veins.
Sure, absolutely, horrible veins.
Gonna need
Cancer patients.
for example, IV antibiotics for an extended period of time.
Repeated administration, sure, great. Any others? A couple of the others,
Necrotic drug, necrose tissue.
necrose tissue, very good. Chemotherapy, we talked about that, Kim just mentioned that. If you need parenteral nutrition is one. Measures central venous pressure is another one, perhaps. And then the repeated administration of blood, you may do that. The saphenous vein or the veins of the AC, kind of the ones that are on there, are commonly used for placement. When the vein is successfully cannulated, the catheter is then advanced to a desired length into a large central vein. The correct positioning of a PICC line is confirmed with X-ray or a chest radiograph. So, complications are air embolism, infection, colitis, thrombus formation, leakage, catheter breakage, kind of what Erica and Tim were talking about, including catheters. This occurs more frequently than other lines because of smaller diameter of the catheter, so there's quite a few occluded catheters. And then just overusage can result in a disruption of the vein requiring more aggressive and permanent venous access devices. You keep an occlusive dressing over the exit site. It needs to be able to see through that. Always aseptic techniques for dressing changes, and then the patient itself can be helpful in limiting its chance for infection just by how well it's cared for. So what can you tell me about these PICC lines? I know that some of you are pretty familiar with them.
I got to help in a surgery on one when I was doing a rotation in Sacred Heart down at Luther. And just the precautions that they go to make sure everything is sanitized and you're gowned and gloved the proper way, and it's rather interesting. You know, I mean, I got to sit there and hold the arm for the whole half hour during the surgery, but it's pretty neat seeing how they're inserted. And then they have the little visual x-ray right on the chest to make sure that it goes not up and that it goes down when it gets to the right area. So the lady that we had was a cardiac patient, and she was getting a PICC line. I'm not quite sure why, but she they had a hard time because the thing kept wanting to go up into the neck area instead of going down into the heart. So it was pretty cool having seen that down at Luther.
The biggest thing with PICC lines is infection. The biggest thing is infection. These people are already immunocompromised for some shape or reason, and this is a direct line for infection to really fester. So
They go right down to the central circulation.
yeah, so make sure that you're using sterile technique when using.
Nice thing about these two is when you need blood drawn 3-4 times a day, they can take it out of there. They're not poking you all over for blood draws.
Most of the time, they don't need to use heparin to flush these either. Most often, these are flushed with just saline.
How long can they usually put them in when given long-term, IV antibiotics and
Yeah.
stuff like that, so they're.
Months.
But there are a lot more problems with the occlusions and stuff because the diameter is so small, so they can stay in, but I bet you they're changed just more frequently because they don't work.
Well, but they're flushed more frequently too.
Yeah, and we do flush with heparin too, just per our policy, I don't know,
Okay.
I don't think you have to, but we do, just because we had a lot of it included. But like you said, they don't.
For a line that long?
But-
My cousin who's going through
And
leukemia
skinny.
right now, she's had one and it's been a year. I don't know if she's had the same one in for a year or not, but that's what her line is, or that's what they've got her. She's
I'm
been
in the same place.
Yeah,
They told us it was pretty indefinite as long as it wasn't infected. And well taken care of, you can leave it in for a long time.
yeah. As far as I know, she hasn't had any problems with it,
I'm
but
wrestling with
she's
who's
got
gonna
nerve
do it.
access.
My brother-in-law had brain cancer. They changed his in 3 months 4 times, because his body ate things. So it ate the catheter too. Destroyed it, they took it out and it was like, oh man. So they do break down.